Health officials addressing the crucial issue of a bed shortage at the country's premier healthcare facility. Fern Carey tells us tonight that a number of measures have been implemented to address the medical crisis.
Health Minister Dr. Dwayne Sands says the bed shortage at Princess Margaret Hospital has impacted the facility's ability to provide surgeries, caused a backup in ambulance services, and is making it extremely challenging to provide care to patients.
This has created a perfect storm. Cannot stop people from getting sick. But there are simply no beds in hospital. At one time, day before yesterday, we would have had 17 patients awaiting admission. We had as many as 100 patients in our emergency room. And we literally had every nook and cranny in the hospital filled.
Dr. Sands attributed the bed shortage to a large number of boarders who are discharged patients overstaying their time at the hospital. Administrator Mary Walker said the number of boarders appeared to be on the rise, and she made this appeal.
We would have brought it to everyone's attention when there were about 20 such persons. We are now approaching 40 such persons. And even in the emergency room, there are 5 persons who fall into that category. So yes, we appeal to the public that if you know you have a relative here in the hospital who you may not even have visited for a while, that you need to come and check that there are certain persons in the facility who are discharged, and we actually need the relatives to come and collect them.
The P.M.H administrator said they have partnered with social services to address the matter, adding that no one will be put out on the streets. Meanwhile, Medical Chief of Staff Dr. Carolyn Burnett-Garraway said a system has been implemented to address accommodation challenges.
So in the accident and emergency department, we're doing tighter triage, which is sorting of patients, to ensure that ill patients are seen immediately, and those that can be managed at the clinics, the peripheral public health clinics, are triaged away to get care there. We are also doing a similar triage process with surgery. So elective cases had to be cancelled today because we didn't have the bed space to accommodate admissions for surgery. The patients will be rescheduled, and all emergency cases are still being done.
Hospital officials are urging residents to utilize the community clinics, which are now operating on extended hours. However, critically ill patients can call the hotline at P.M.H at 326-7014. Fern Carey, ZNS Network News.
And while authorities address the bed shortage, they're also looking into the shortage of nurses at the Princess Margaret Hospital. Hospital Administrator Mary Walker says government has established a special commission to get to the bottom of why Bahamian nurses are seeking employment opportunities abroad.
Nursing advertisements are out on a continuous basis. I think we have employed every Bahamian nurse who wants a job, and even the ones who have retired are back with us doing sessional shifts with us. So yes, we are advertising on the international market, and I guess you can say just from being through the hospital you will realize that you can see that diversity in ethnicity when you come through with our staff. We have about 13 different nationalities here working on this compound, either in the capacity of nurses, physicians, and allied health professionals.